I wonder if we could start out by kind of thinking why we're here in some way. So why is early intervention important to jobbing GPs? Why should we be discussing this?
Okay, well, psychosis is one of the most serious mental health problems that a young person can develop. Although it isn't frequent, it's dramatic, it's potentially dangerous in terms of risk of suicide, and these youngsters are on a path to huge inequality, whether that's health inequality in terms of loss of life, perhaps up to 20-25 years loss of life, or to social inequality, so they can't get a job. 88% end up with no job. So it's an important issue. It's a very distressing, stressful time for a person and their family. So in terms of distress, there are a few situations that cause more distress, and so those are my sort of initial thoughts.
Okay.
I think the other thing to stress right at the beginning as well is that the incidence for each general practitioner each year is tiny, and so maybe it doesn't feel terribly important when you're dealing day in, day out with people with heart disease and diabetes, and it's very difficult to remember that once or twice a year you're going to get somebody come through your door who may actually have first episode psychosis. But the analogy that we often use is around meningococcal meningitis, and it's okay, it happens very rarely, but you have to know how to treat it. And you can't imagine a situation where you wouldn't have benzyl penicillin in your bag to treat it. You wouldn't dream of not. It would be medical legally negligent. And yet there is somehow not quite that mindset yet with young people with first episode psychosis. So yes, it's a tiny part of our work, but it is so important for all the reasons that David's just outlined.
Another key issue that I'd want to pick out is the trauma of late engagement. So historically, these youngsters engage with difficulty. They, in terms of specialist service response, they come in at the wrong age. They're sometime between the ages of 15 and 25. Now that's difficult because it spans the traditional separation between children's services, adolescent services and adult mental health services, and the engagements are traumatic. So before the advent of early intervention services, you were looking at hospitalisation rates in the first episode of something like 80%, and these youngsters and families have been asking for help for 12 to 18 months with active psychosis. 50% of the time these youngsters are engaged with the use of the Mental Health Act. Police were involved. So very traumatic engagements. And one of the key important messages about the intervention is about the trauma of that intervention, trying to move away from crisis response further upstream.
Right.
Yes, as a GP, I've just been struck that it would be great to try and improve the service for these patients. It's such a serious illness to befall a patient and their family, and it would be great if we could get the care as good as possible and on a par with other serious illnesses, be they mental, be they physical. These patients deserve a good deal.
Okay. Thank you very much. That's very helpful. You've touched on the notion of kind of moving things upstream about